Stage 2. After shift report, the nurse goes in to check on Mr. C and she finds him diaphoretic with facial grimacing. Mr. C reveals that his pain is even more intense than the day before. And the nurse then alerts the physician and he orders a STAT, CBC, and CMP. The results from the nurse's assessment, along with the diagnostic test, revealed that his temperature has increased, now 103 degrees Fahrenheit. He has no known drug allergies. What's also important to mention is that he has right upper quadrant tenderness, but also leukocytosis, which is characteristic of acute cholecystitis. Also, the ultrasound reveals gallbladder distension as well as common duct dilation, and the HIDA scan reveals a delayed gallbladder filling, which is also characteristic of acute cholecystitis. Based on the clinical findings, the physician diagnosed Mr. C with acute cholecystitis. The orders then include an admit to surgery, IV antibiotics, and also to perform a laparoscopic cholecystectomy within 24 hours. The nursing interventions used were also based on clinical guidelines, and it is to administer the IV antibiotics. The antibiotics for Mr. C will be cefazolin 2 grams IV every 8 hours, and this is also based on the clinical guidelines. In terms of pathophysiology, acute cholecystitis is the inflammation of the gallbladder. The most common type is the calculous cholecystitis, and what happens is the gallstones obstruct the cystic duct. When this happens, inflammation and also irritation, but more importantly, the bile is then reabsorbed. The reabsorbed bile acts as a chemical irritant, and then which leads to gangrene, infection, and from that the gallbladder can rupture. So the nursing interventions after Mr. C has his surgery are to assess for oxygen saturation levels, to offer food and water, but this needs to be done once he's fully awake, and we supervise. Monitor for nausea and vomiting, as well as elevating the head of the bed, which goes with the fact that he may be vomiting. And we want to get him up and walking as soon as possible, so we want to assist him to the bathroom and administer any oral opioids that the physician may prescribe. So another thing to do is to teach the patient, once he's able to receive the teaching, is that he needs to report any abdominal or epigastric pain with vomiting several weeks after his surgery. Questions for stage 2. Why is it important for Mr. C to report any abdominal or epigastric pain with vomiting occurring several weeks following his surgery? The second, when can Mr. C resume usual activities? And what are the advantages of Mr. C undergoing a laparoscopic cholecystectomy versus the traditional cholecystectomy? To answer that question, the first one, why would you tell the patient it's important to report any signs and symptoms after the surgery? Is that Mr. C could be at risk for post-cholecystectomy syndrome, otherwise known as PCS. And what happens here, it can result from a pancreatic duct stricture or a pseudocyst, and what it is he may have an underlying illness. So if he doesn't report, basically patients are a little apprehensive when it comes to reporting any of the signs and symptoms of epigastric pain following several weeks, because they may not want to come to terms that something else may be going on, and they also have to deal with the fact that they had surgery not too long ago. So it's important to stress that so that they can report it, because it may be something else that needs to be addressed. Mr. C can resume usual activities within a week following surgery, but we also have to remember he's actually in a rehabilitative center. So what would be common for him may not be what was common before his incident. There are many advantages to laparoscopic surgery, and some of them are low death rate, reduced risk of bile duct injury, and faster recovery time, which is really important because it's already receiving other therapies based on his accident. So it is a good thing that the laparoscopic surgery offers him a faster recovery time. Post-operative is less severe and complications are uncommon.